Welcome to the Man Cave Podcast with Dan Casper.
Hey, we got lots to catch up on, Austin. So let's start off with your quarterback, shall we? Jayden McCarthy going to be out a couple weeks and such. Now, I know there were some fans out there kind of saying, well, finished the game and, already, declared out on Monday, like conspiracy theory fans out there and such. I mean, so I don't know if you're a part of that or not, but, with this ankle injury, is it the high ankle sprain that's going to keep him out a couple weeks?
Yeah. So, they showed the clip. It looked like a pretty classic hip drop tackle. And the classic basically kind of got the foot gets stuck and you get this big extra rotation moment, which then really what it's trying to do basically pull the tibia and fibula apart, which is the high ankle. He was obviously able to get to the end of the game. And so I can see why some people, because I was at the game and it didn't look like it affected him, but I can tell you those high ankles, they can swell up, they can be nasty. So for a guy to miss time with a high ankle sprain is pretty standard. So, people are often able to play through kind of more standard lateral ankle sprains much more commonly, where these high ankles it is really hard to get around and move. So probably the adrenaline got him through the game, and then the ankle swells and starts hurting. And so it's not uncommon for a guy to miss. Could be a couple weeks. I think I've heard him throw out 3 to 4 weeks, and that wouldn't surprise me.
And I was kind of wondering too, would the swelling kind of maybe like come up after, he takes the tape off and all that stuff in a few hours after that, and that's where it really kind of popped up?
Oh, absolutely. Yeah, you'll get that kind of delayed effect where it's like, there's the initial pain, but then when the swelling kicks in, and it absolutely worsens the symptoms. So there are plenty of guys who are able to kind of hobble through the end of a game, and all of a sudden it's like, wow, this is worse than I thought.
Mm-hmm. Is there any talk or any, I don't know what the degree would be. When we've talked about high ankle sprains, it's that surgery afterwards. Is there anything with that, or is he not, it doesn't sound like it's that type of high ankle sprain?
Yeah, I'm sure he got an MRI to assess the severity. So kind of the classic, grade 1, 2, 3 injury pattern. If it was a 3, he'd be getting surgery for sure with complete disruption of the high ankle, or what we call the syndesmosis. The grade 2s are a little bit more hit and miss. There was a trend there for a while where we saw some guys, I think maybe Tua had it in college. There's a couple college quarterbacks that had it, where they'd get that tightrope procedure where we basically take a little metal button on each side of the tibia and the fibula, and we kind of squeeze the bones back together, and there's a really strong suture between them. Basically those are probably for grade 2s where you do it to accelerate the recovery. But if they're already staying 3 to 4 weeks without any surgical intervention, it's going to be kind of more of a standard grade 1, maybe a low-level grade 2 injury where there's a lot of fiber still intact. You just need to let it heal up and get the pain and swelling under control.
And then Aaron Jones placed on injured reserve, at least out 4 weeks with that hamstring injury. I know since we're talking grades and such, I would imagine maybe at least I'm going to put on my doctor hat here, maybe a 2 or something like that to land on injured reserve.
Yeah, for sure. If they right out the gates go injured reserve, it's a significant injury, absolutely. So, he's been a guy throughout his career who's struggled with injuries, no question about it. This has been an injury that he's had in the past that's kept him out. So, hopefully he's able to bounce back well. But it's one of those things. Especially in a position like running back, if you have a hammy that's not working, you just can't be on the field. So they went straight to the IR for him, and we'll see if he can get back at 4 weeks or if it extends beyond that.
What's going on with Christian Darrisaw's knee injury? Have you heard anything or any input on that?
Yeah, so the way they've been talking about it sounds like things are looking promising. There were some reports he was potentially going to play last week, and we definitely need him. Our O-line is looking pretty porous right now. So it sounds like he's making good gains. So now it's kind of like a week by week at this point where they're going to see if they're going to start letting him get some more reps in practice, but they haven't really got him on the field yet for there. So I still think he's a little bit away, but they were hinting that he was maybe going to start getting on the practice field more. So it'll be interesting to see it. All reports sound like the knee's doing well. So that's obviously a great thing to see. Anytime you have an ACL injury, a lot of guys get back, but it's not always perfectly smooth, as we know from previous guys. So at the end of the day, it's going to be kind of that transition of like getting them back on the practice field, seeing how the knee responds. And of course, what you don't want to see, of course, is that all of a sudden the knee starts swelling and things like that, where you're worried about like a cartilage-based injury, and there's no reports of that. So overall, appears to be going well. Hopefully in the next couple weeks, we'll be seeing him out there.
With moving over to first place Packers, by the way, had to throw that in there. Jayden Reed, we know, had the clavicle injury and surgery, but also apparently got the foot surgery with it too, that Jones fracture. So my question to you is, would that be a similar timeline? Because when they were talking about the clavicle injury, he could be back in November, but since he had the surgery on the foot, would that make him out longer? Would it be a similar time pattern? Or what do you think about having him do both surgeries at once?
Yeah, interesting move. I think I would be, I don't want to say hesitant, but at least think about it, because often when you do, the Jones surgery, so that what we do is we basically take a solid screw and fire it right up basically the fifth metatarsal where that Jones fracture is at the base. You often keep them limited weight bearing. So what does that mean? It means they're crutches or something to help them get around. Well, he just had surgery on the clavicle as well. I bet he's probably using a knee scooter then to help him get around without loading that shoulder. So that's probably how they're getting around it. But if you look at timelines to answer your first question, I would say the clavicle you're looking at about 6 weeks, give or take, depending on exactly what the fracture pattern was and how it heals. Right in that window, 6, 7, 8 weeks, somewhere in there. Now on the flip side, if you're talking about the Jones, I would expect it to be a little longer than that. But I mean, the question is this a Jones fracture? So when we get those, sometimes you diagnose those on X-ray where there's actually literally a visible break. You're like, all right, that there's a full fracture there. Sometimes we see them on MRI where it's basically more of a stress reaction, early stress fracture. So if they're treating it more like that, and they'll still call it a Jones fracture, but if it's not a displaced fracture, it may heal more quickly, and especially because they were treating it without surgery. I wonder if that's more of what it was. They haven't disclosed that, but point being, if it's more on that stress reaction, stress fracture side, that's something that could certainly be back by that 6, 7, 8 week, same kind of window. But if it was a full displaced Jones, usually we'd keep them out probably another month beyond that. So I think time will tell which way it was. And my guess is if they're like, hey, let's just do them both, the timeline will be similar. I bet it's going to be more of that kind of stress reaction, stress fracture, as opposed to a full displaced Jones fracture.
Interesting. Now, this one just happened yesterday. We don't really know a whole lot about it, but there was reports coming through that Tucker Kraft hurt his knee in practice yesterday. Status unknown, not knowing how severe it was. And then you had the national people coming out saying, well, it's just a tweak. It was just a little bit of a scare and such. So, I mean, is that an official diagnosis, tweak of the knee, when you hear something like that?
Yes, it is a grade 2 tweak. No. I mean, my suspicion is going to be like basically probably a buckling event. And especially when they're non-contact, everyone obviously gets very nervous. So I would imagine something like that happened. But from all initial reports, sounds like everything checked out well. So that means that the ligaments feel good. There's no swelling in the knee. He's probably having little to no pain. But probably what it is a combination of maybe a small bone bruise, or maybe like a low-grade MCL or LCL injury that's not going to keep him out at all, and something that most guys can play through without really any ill effect. So that's the assumption, certainly. But from what the initial discussion was, it sounds like people thought it was something bad, and then all of a sudden it's like, oh, it turns out it's not as big a deal. So that's obviously great news for you guys.
Yeah. Zach Tom, I want to just kind of talk about him for a second, because obviously he had that injury week 1, where Jordan Love got pushed into him and Zach Tom landed. It looked like it was his hip, but they kept calling it oblique. And he's back at practice, but he made a comment earlier this week saying, it still hurts to kind of run straight. When he moves side to side, he's good, but there's still pain when he runs forward. When you hear somebody kind of describe that, what are some of the possibilities that maybe he's kind of going through right now?
Yeah, I mean, when you're moving in the straight line, I mean, you're still going to get rotation through your torso and upper body. So that's really where the obliques come into play. If he's talking about like shuffling side to side, you're not going to get as much of that rotation at your core. So, I mean, that does fit with kind of that oblique injury, off of that kind of hip pointer area, because that's your obliques. That's where they insert. It's like if because I remember the initial reports were hip pointer, which is traditionally basically a bad contusion right at the pelvic rim on the side of your hip. Your iliac crest is what we call it. And so That's where the obliques insert. And now it's more kind of evolved into this. Like we think it's more of like an oblique injury, so that'd be more of the muscle itself. So either way, that would make some sense. So again, you run in line. I mean, even though you're moving in a straight line, I mean, your upper body and lower body are rotating in opposite directions, right? That's how you stay balanced. And that kind of rotational torsion, that definitely puts some stress through the oblique. So at the end of the day, that kind of fits with that pattern of an oblique injury. I mean, those things can be really things that nag and linger for a while. Not to the point where it's like, this is a serious career-ending issue, no way, but certainly something that could bother him a good chunk of the season. So hopefully it bounces back quickly, and usually they do, so I would expect it to resolve, but they just don't always go away. And as you try to return to activity, sometimes, the goal and hope is like, hey, we're getting back, it's feeling better, and then all of a sudden you kind of tweak it, the word of the day, tweak it again, yeah. And all of a sudden it's like, oh, it's a bit of a setback. So with these muscle-based ones, you do see that relatively frequently where you have a plan. It's like, all right, this week we're going to get back to do some light contact and practice. How's it go? Turns out it doesn't go great, and it's a setback, and then you got to kind of reassess the next week. So it's probably going to be one of those week-by-week type injuries.
All right, before I let you go, I was saving this one for last. Joe Burrow with that turf toe. I mean, what they said, yep. Grade 3 and all that surgery, and hasn't had surgery yet. It sounds like still kind of waiting for swelling to go down. But I mean, I know it feels like the Bengals are trying to be optimistic 3 months, but everything I've read says no, it's going to be longer than that potentially. So I mean, just how bad does this turf toe injury sound for Joe Burrow, and is there any possibility it could affect the rest of his career?
The answer is big time injury, and absolutely can be an issue career-wise. I mean, there are surgeries that we have that are just really reproducible and have really high success rates, and then there are surgeries that are a little more challenging. The one thing is he's already been through one of them. I mean, we talked about with his wrist injury last year. I mean, you remember me saying, like, this is a potentially a career-ending injury, and he came back just amazing for that. So that is fantastic for him. Turf toe is the same thing. I mean, that's a surgery that basically, just to kind of recap what that is, so basically the really thick capsular structure ligament on the bottom of your great toe at that joint, it's a thickening that we call the plantar plate. And so what turf toe is where the toe gets dorsiflexed up or pushed up and it rips that plate. And a grade 3 means it ripped all the way off. Occasionally you'll even have injuries of we call them the sesamoids, which are two little bones. Think like the kneecap sits in the front of you have two little tiny bones that sit in the bottom of that toe. Those can be involved and torn as well. So especially if you start getting involvement of the sesamoids, I mean, those are just it's a crapshoot, just to put it bluntly. And again, turf toe sounds like such a benign thing. It's like, it's a toe. Come on, guy, get out there. But it's about half of your strength comes off that part of the foot. And so, luckily he's a quarterback, not a running back or receiver. But still, I mean, you need to be at least somewhat mobile. So when these don't turn out well, some guys end up getting early arthritis of that joint. Some people have persistent pain and stiffness. I do think that it would be something he to be able to compensate and just make a really rigid sole in the shoe and just say, look, you're just not going to be exactly as mobile as you used to be. So I really don't think there's any chance it's going to end his career. But could it affect his mobility for his career? It's possible. So this is definitely a serious injury. And again, turf toe doesn't sound like a big deal, but it is. It is. So this is going to be, and as far as your question on timeline, yeah, I'd say 3 months is very optimistic. I would be surprised if he gets back at that point, but there's probably some modifications they can make to a shoe that might make it doable, but I'm sure they're going to keep a close eye. And with a franchise quarterback, they're not going to push it unless they think he's ready.
Mm-hmm. Absolutely. Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine. Appreciate the time again this morning. Always love chatting with you, buddy. Have a fantastic weekend, and we'll catch up with you again soon, okay?
Absolutely. You take care.
You got it. Dr. Austin Crowe, again, Chippewa Valley Orthopedics and Sports Medicine.